ready? We're looking at the infratemporal fossa region here. We have, as we look at the top here, we have some of the branches that are going to the orbit. This is the trigeminal nerve, this is the trigeminal ganglia, this is ophthalmic branch of trigeminal, maxillary and mandibular branch of trigeminal. This would be cranial nerve, 4, trochlear, 3, ocular motor, and 6, abducens. So this goes 3, 4, and 6 as you go down. 4 crosses over. So this is trochlear, ocular motor, abducens coming into the eye here. This is the ciliary ganglia with the short ciliary nerves coming off of it. This is the lateral rectus muscle with the abducens nerve going to it. This is the pterygopalatine ganglia. Down here, pterygopalatine ganglia. This is the infraorbital nerve. This is the posterior superior alveolar nerve. Those are branches of maxillary. Branches of mandibular. Mandibular nerve comes through the foramen ovale and immediately branches. We've got some deep temporal nerves here which innervate the temporalis muscle. We have the auriculotemporal nerve here which goes on either side of the middle meningeal artery, then heads up in front of the ear to innervate the skin on the front of the ear. I'm going to set this down so it's not wobbling so much. This is the inferior alveolar nerve. Before the inferior alveolar nerve enters the mandibular foramen, it's going to give off nerve to mylohyoid, which innervates mylohyoid and anterior digastric. Inferior alveolar nerve supplies all of the lower teeth and gives off the mental nerve, which comes through the mental foramen to innervate the skin on the chin region. This is the lingual nerve. Lingual nerve is going to be joined by the chordae tympani nerve. Chordae tympani nerve is this thin little nerve back here which connects the facial nerve to the lingual nerve. Chordae tympani is going to be carrying taste sensation fibers from the anterior 2/3 of the tongue, as well as parasympathetic preganglionic fibers to the lingual nerve. Then we have the buccal branch of trigeminal, which is going to be sensory to the skin on the cheek. So we've got deep temporal, buccal, lingual, joined by the chordae tympani, inferior alveolar, which gives off nerve to mylohyoid. Nerve to mylohyoid is not on this model. And mental nerve, auriculotemporal. This is the facial nerve coming through the stylomastoid foramen, giving off the chordae tympani nerve, innervating the stylohyoid and posterior digastric, and then branching into its branches. The branches that we can see here are mandibular branch of the facial and cervical branch of the facial. As we look down here, coming out the jugular foramen, we've got cranial nerves 9, which is going to be way in there, 10, which is going to be vagus coming down here, and 11, which is spinal accessory. Cranial nerve 10, vagus, gives off the superior laryngeal nerve. Superior laryngeal nerve branches into the internal laryngeal nerve, which goes through the thyrohyoid membrane and is sensory, forms the afferent limb of the cough reflex. And external laryngeal, which goes down to innervate the cricothyroid. Vagus will continue down, giving off the recurrent laryngeal, which innervates all the rest of the laryngeal muscles. This is the superior root of the ansa cervicalis, which is coming off of or hitching a ride with hypoglossal. Hypoglossal is coming out of the hypoglossal canal. So we've essentially gone over all the cranial nerves here. What I really want you to focus on, though, is branches of mandibular branch of trigeminal, as well as branches of facial.